Hi, my name is Michael McGuire, and I chose to do my disease presentation over Lyme disease. Lyme disease is most commonly caused by the bacterium Borrelia burgdorferi. The first thing I'm going to talk about is the shape and structure of this bacteria. These bacteria are highly motile and have a spiral shape. In addition, their cell wall consists of a cytoplasmic membrane surrounded by peptidoglycan and flagella, and then by a loosely associated outer membrane. The most common way these bacteria come into contact with humans is through the bite of Ixodes scapularis, more commonly known as the deer tick. In this slide, you can see the life cycle of the deer tick. First, the adult females drop off hosts to lay eggs. Eggs then hatch into six-legged larvae. The larvae attach to and feed on the first host and may acquire the bacteria at this point. The larvae then molt into nymphs after leaving the first host, and at this point, they can infect humans. Luckily, there are some early signs and symptoms of Lyme disease. One of the earliest signs of Lyme disease is a bullseye-like rash that appears at the location of the tick bite. This rash is an early warning sign in 70 to 80% of Lyme disease infections. Unfortunately, not everybody gets this rash, so not everybody knows they have Lyme disease at an early enough time. The majority of individuals that contract Lyme disease completely recover and experience minor symptoms such as fever, chills, headache, fatigue, muscle aches, joint aches, and swollen lymph nodes. However, 10 to 20% of infections have lingering effects, and if left untreated, symptoms can become much more severe. Major Lyme disease symptoms include severe headaches, facial palsy, arthritis, heart palpitations, inflammation of the central nervous system, and nerve pain. The effects of Lyme disease. Lyme disease has both a public health impact and financial impact on the United States. While early-stage Lyme disease can be treated cheaply with antibiotics, unidentified late-stage Lyme disease can lead to excessive healthcare costs. Many studies suggest that Lyme disease imposes an economic burden that could be considered significant in the US and other developed countries to justify further research efforts in disease control and management. In addition to the financial impacts, individuals that do not receive early diagnosis may have severe lingering health effects, such as an inflamed nervous system, heart palpitations, or joint pain resulting in a decreased quality of life. The epidemiology and statistics of Lyme disease. While the first recorded cases of Lyme disease in the United States did not occur until the 1960s, the disease has likely been around for thousands of years. Over the last several decades, the number of cases has drastically increased, and now on average, it is estimated that the US has 300,000 cases of Lyme disease annually. In this slide, you can see the growth of Lyme disease between 1991 and 2016. And as you can see, in 1991, there were roughly 100,000 cases. Now we average around 300,000 cases a year. Luckily, there are treatments for Lyme disease. If Lyme disease is detected early, treatment using oral antibiotics is typically very successful against the infections. And here's how these antibiotics work. The antibiotics go into the bacteria, preferentially, and either stop the manipulation of the bacteria or disrupt the cell wall of the bacteria and kill the bacteria. The first one being deoxycycline, that one stops multiplication, and penicillin affects the cell wall. Here is the recommended treatment regimen for early stage Lyme disease as posted by the CDC. Here are the references, and thank you for watching my presentation.